Thanks.
Yes. เดี๋ยวต้องไปช่วยพี่ก็ได้
ได้ครับ
นั่งกัน วันตามลำดับ
Just it's okay. He will take care of it.
Mhm,
You just sit there and you just go there.
share the video on Zoom. I share the video on Zoom. Okay.
Okay. So you place the dot. It's already shared on the screen already.
Share the on Zoom.
Yeah, share screen. Ready or not?
Just. Oh no.
Just go for share.
Electronic medical record providers in the Philippines. We wanted to be able to showcase that there is a way to more efficiently and cost effectively process all of the digital information being collected at the patient level, and how we could leverage all of that so that it could be an influencing factor and a critical element for us to arrive at crucial policies that will be needed for implementation. We have been at this for the better part of 2 decades, and we are still working towards a much more improved ecosystem for electronic medical records and electronic health records. Interoperability, we really started on this probably 2014, 2015, and then moving forward a few years thereafter on making sure that
Please wait for 1 minute, please.
or let's say devices such as this telemedicine device, RX box, be able to connect with other electronic medical record systems and other digital health solutions through innovative ways of information exchange. And in this scenario, it will be
ใช่ไหมมีคนเปิดไว้ก่อน Yes, close. After that, it's possible. เดี๋ยวพอนั้นหนึ่งกันนะ Yes.
So we will start the session. So are you ready for this health and society resilience session? Huh? So good morning, everyone again. I hope that you enjoy our morning session with everyone, a lot of people in the room. Now it is time for us to dive into each specific topic in the parallel session. And now our session is like, thank you for choosing the health and society resilience. And my name is Tanta, and I am very privileged to be just the one who introduced, not even MC. Just start introducing the session. And today we are very privileged to have the very knowledgeable speakers, experienced speakers who are going to talk about what is our future prospect for health resilience. We are talking a lot about resilience now, and then what are the direction we should move forward to get to be back better BBB. So now we have we are very honored to have the Dr. Wongsa, Laohasiriwong. She is the Dean of the Faculty of the Public Health and from the Khon University. So she is going to be one of the speaker, as well as she will be the moderator of the day. That's why this is only me talking just the beginning. After that, I pass everything to her. No? Dr. Wongsa, thank you for taking the workload from me. Then we are also very honored to have Dr. Vi Mani Bokam. She is the Deputy Director General of the Department of Planning and Cooperation from the Ministry of Health from Laos PDR. Yeah, she is also like the one who is really having experience writing the policy guideline in the COVID-19 recovery framework. So what is the Lao experience when we talk about when we move forward to the more health equality access, what are the aspects we need to consider? Then we will also have, because now it's like digitalization is everything. No, we cannot see each other in person. Then there is a lot of innovation took place in health setting as well. So for that, we invited Dr. Raymond Francis from the Philippines, but he could not come here in person. He will be participating virtually. He also sent us the video record. So there he's gonna talk about what our region has been doing to make the digital solution for health more affordable and accessible. So now we talk about the more accessibility. The solutions are there, how to make it more accessible and affordable and treatable as well. Then finally, last but not least, definitely we have that vision come out and vision, no? And which is about the One Health movement and One Health implementation approach. And we are also very privileged to have the Dr. Wipa from the Executive Director of the Southeast Asia One Health University Network, who has been kicking off, rolling out a lot of capacity building program and through the network. And so he is talking about what are the necessary steps to move forward. So this will be our today program. And now it's like, I will pass this to Dr. Wongsa. So Dr. Wongsa will just start as before she began the moderator, she will just set the things, talk about overview, and then she will move to being speaker herself. Then you need to move to being moderator yourself, Ka. Thank you so much.
Thank you very much. Good morning, respected speaker, audience, like special guests, and also the organizers. Thank you very much for giving me this opportunity to share with all of you this special session on strengthening innovation and coordination of One Health implementation in the GMS, because I'm it's under the topic of strengthening health and society resilience. So how could we recover from COVID or the pandemic fast enough? And then why? After you follow our session, you will understand why we have these 4 topics all together, overview by me of the strengthening innovation and coordination work and information management for One Health implementation in GMS. And I say we will finish by Dr. Wipat for One Health. And also we will see why we are different, right? The outcome different, suffering are different. Dr. Wiengmani will talk about bridging the gap of promoting health equity, and also I think we experience a lot of digital health solution. Dr. Samianto will talk about that. So this is part of the lesson learned from COVID-19, right? I think it's one of the biggest pandemic ever that affect people worldwide. So lesson learned from the COVID-19, especially the subregional strength and gaps in achieving resilient health system. How could we improve and get back to normal or start up for the future? So this is part of our studies in terms of GMS. Actually, we study about Southeast Asia, but we focus now about GMS in public health emergency response. So this is very important, because when you talk about GMS, they are very interested in. Without China, we about 250 million already. With China, we are 300 something, because Yunnan and Xinjiang is also involved. So it's very big target. I think now Bill Gates also target us for the food supplement. Yeah. So actually, where we are before the pandemic, whether we're ready to really combat or manage the pandemic. So you and the United Nations have 3 indicators for pandemic preparedness. So there are 3. The first one is Human Development Index. The second one is quality of health system. And the other one is connectivity. In terms of human development, they have the measure is expectancy, long and healthy life, and knowledge in terms of expected enrollment in the school and school years, and also the decent standard of living, like incomes or something, because it's not income alone that could show that this is something about that. But this is the real indicator. This one is very good because the indicator is in 2018, 1 year before the starting of the COVID-19. So you see that on the left is human development, and also the middle is like health system. The third one is like connectivities. So the colors show like low is red, right? And orange, yellows, and high is green. See, so we could use other country in the Southeast Asia to be like, how you call that one, reference. So Thailand is the highest among the GMS, but still not very high. Very high is like 8 and above. So it's already Singapore, Brunei, and Malaysia. Thailand is close. But when you adjust it with the inequity, right? Dr. Vimani will be, this is inequity, Thailand also not that high. And then it's followed by Vietnam and Laos, PDR, Myanmar, and Cambodia. So this sort of thing. And you see that this is the index for human development. This is quite, like we are still not so high, but it's not so bad anyway. Not really kind of red. But you see, in terms of health system, there are three indicators. There are the indicators that they use. The first one is physician, it means doctor per population ratio, nurses, midwife per population ratio, hospital bed per population ratio, and health expenditures, right? So this one is very tricky. I think some of you could answer that. But you see this one, in terms of physician, you see what happened to Thailand. Right, Thailand is quite good, right? But in terms of a doctor per population ratio is really low, right? And then like, but Philippines is high, but you see like Cambodia is very low. And then for the nurses, right? Thailand is okay, Philippines is very low. Why? But our other GMS is like quite low. And then in the hospital base is very kind of you call severe. And we are in the alarm one. And for health expenditure, what happened? High or low is good. The highest is Cambodia, 6.1. Myanmar is 5.1. No, Vietnam is 5.7. And then Myanmar is 5.1. But Thailand is very low, 3.7. Right? What happened? High or low is good. It depends on the outcome. If the outcome is good, so low is good, it means efficient. But if you in some country like Cambodia and Myanmar, because there is no universal health coverage, they have to pay out of pocket. That's why even the outcome is not so good, but they spend too much. So this one is underserved and they are really inefficient. So that's why all of us, the heading for universal health coverage like Lao PDR really try, and I think quite really good in somehow. And then, but this one is mean low expenditure, is mean underserved. And then in terms of connectivity, it means that the mobile telephone. So you see that Thailand is the highest, 180. So it means one person may have two mobile phone. But you know, but this one is like the broadband, the big broadband, so it's in home telephone or something like it's not that high, but in some country it's quite low because of some of the internal issues. So this means, so it means that we are not that ready to combat, right? Or really work to manage the pandemic or any really big epidemics. So, but in terms of coordination, innovation, and health technology, public health emergency, you see that only a few months after the pandemic start, the innovator have shared countless of solutions. You see that 10 innovation technology that have been used like AI, blockchain, open source technologies, telehealth technology, 3D printing to kind of, gene editing technology, nanotechnology, synthesis biologies, and drone and robot. So this has been used a lot. You see that even we are not ready, but when it's in need, we like the society could move very quick, and especially these sectors. This is the digital application used in the ASEAN member state, you know, and I highlight Laos, Myanmar, Cambodia, and Vietnam. So it means it has been used for contract tracings and and also communication, supporting decision making, economic recoveries, aid distribution, and behavioral change. Why no Thailand? Because I have another one for Thailand, because there are so many, you know, we get confusing, and they just announced like declare process like about 2 weeks ago. So in terms of tracking, so there are many, so mostly is kind of like by private standard for setting, so and then vaccination history and industrial as individual assessment of many sectors, even among general population, and also various type of person include village health volunteers. So this is the one that we use in Thailand. And then like based on our like studies, we found 3 groups of activities that we have done in order to combat COVID or maybe kind of pandemic in the future. So the pillar one is prevention and preparedness. So the first one, emergency broadcast service. So they use a lot of technology, social distancing and behavioral change, remote Medicare, telemedicine using application that mostly developed by private sector, but public also modified. Predictive research, creating application, behavioral change. And the second one is about detection and risk assessment. In pillar 2 is digital contact tracing app. So I think all countries we use this one. Self-reports of the symptom, communication channels, and information application, providing data about pandemic situation, support for policy choice in decision making. And the third one actually be really kind of, this one is for kind of proactive and genetic vaccine, like wearable technology and early detection, discovery of the way in drug use, age distribution, and economic recovery, which now in the process of that one. Then, even I mentioned different country in our, this one is from the Southeast Asian one, ASEAN one, and then we are 5 countries in this graph. So it means not all countries implemented. You might notice that for mass testing, only 1 country that fully implemented, and 4 is partially implemented. And then for contract testing, so 8 countries, and declare state of emergency is about 5, and partially is 1, and did not really implemented is like kind of 5. So, and then also they can lockdown also half, and also declare curfew, right? I think Thailand did it, but partially like a border closer. You see, most of us did, and all the intervention that's all member implemented is like post screenings, like traveling brand, social distancing, school and university closer, and also closer of public places. And this one is mean the 5 that being implemented. Why did we do it? Why not others? And then the other one is punishment on violation of isolation. So half of us did it, and also other measure also. It depends on country to country. What are the factors contributing to different implementation, whether it's about resources or about the policies, mindset, or whatsoever you might think, look back to your country or your kind of really organization. And this is the lesson learned from past disaster and feature of 10 lessons and good practice from Asia Pacific. So we include this one. What gonna happen? What have ever happened for COVID is being because unaware. We didn't know before. It just popped up and just spread very quickly. And health first. The faster and stronger health response is critical to contain pandemic and preventing of socio-economic crisis. This is very important. Rapid funding is pivotal to protect the most vulnerable ones. So there are a lot of people got suffering, like they do not have any jobs or incomes. Get evidence, data system, the information system in order to help assessment and guide the recoveries. Not only combat, but recovery. Show me the money. So it means we need diverse financing arrangement to help sustain long-term recoveries and be the leader. Dedicated national leadership is essential to achieve effective recovery, stronger together, engaging a local government and community for inclusive response. Build forward. Greener, smarter, better. I talked to Dr. Pipat and use the data. This data can help country dealing with the changing landscape. And also what we want is innovate, right? So, and then why One Health? I don't know whether any of you have public health background or medicine. This is what we call epidemiological triad on infectious disease. Actually, it could apply for other. So the cause, right? The causal model of any infectious disease have 3 components: agent or pathogen in this one, like COVID, host, it means the people, and also environment. And sometimes we put vectors because it's not direct, right? It could be animal, it could be other things. So whatever you consider only human health and not consider our vector, animal, and other environment that is really important. We might have really problem that we could not really prevent anything. So the characteristic of climate, physical structure, population density, social structure, housing, and other also as environment that very important, that in order to combat, we not really talk to one thing, but very comprehensively many things. And then like how COVID pandemic relate to One Health. So actually we really realized that the COVID-19 pandemic have profound impact on human health, society, and economies around the world, highlighted the interconnectedness between biodiversity, healthy environment, food system, and our health. And it has revealed the vulnerability at all levels of different sectors and different countries. Or the warning of the pandemic arrived from previous unknown zoonotic, right? And other like H5N1 or something. But it has been like signal for many years. The COVID-19 crisis have reinforced the urgent need for integrated One Health approach to pandemic prevention. This is very important. So what should be the mechanism for GMA country that need to increase in terms of innovation, coordination to move forward to resilient health society? So in terms of One Health, I think Dr. Vipat and Professor also know very well about the interconnected of human health, animal health, and environmental health. What we want is really important, that we want the kind of structure and discipline, that sector and discipline to work on these 3 sectors like as one. We want healthy human, healthy animal, and healthy ecosystem through the coordination, collaboration, communication, and capacity building of the society. I just would like to bring like the mindset of all of us, the mindset and attitude and practice how to. So I think this one, if we could agree on this like issue, I think we could move forward. So this is the basic operational framework, like adopt the system based, where we could not do things separately. You have to be very systematic and undertake comprehensive system mapping. So we have to know how it links. And because I like this one, prevention is better than cure. So that's why I select this slide to like introduce to Dr. Ripert. Assess system flow and efficiency. And different sector and discipline work together effectively. And I would like to talk about efficient actually. Implement multi-level engagement and decision-making. Work within natural boundary and ecosystem, and also integrate national capital. So it means payment for ecological service into the decision-making. I think this one is, I think Dr. Vipat will explain. And then like, I would like to mention what we want to see to make sure that we are ready to combat or prevent the public health emergency or this pandemic. So it means the outcome of One Health, what I think is correct. You have to help me. This one, we want well-being of the people, right? Our people, and we want that nature, sustainability, and also food security. We not really harm the environment by use chemical or whatsoever. And then kind of, what is the transformative outcome that we want? Is mean reduce risk of future pandemic and outbreak. So we hope that with the implementation effectiveness of One Health, we could achieve this one. And the second one is higher productivity, resilience, and sustainable landscape. So it means the environment, improve ecological service, biodiversity conservation, and pollution control. So this is, can we do it, and how we're going to do it? And also better quality, traceable food, and green and sustainable consumption. BCG model maybe help us to for many things. And also the improved climate mitigation, adaptation capacity, carbon footprint, and like or whatsoever. So among this one, transdisciplinary of collaboration, coordination, and communication, this will be the one that we expected. So this is the overview by actually the first speaker and moderator of session, in order to make sure that you could really learn or share with the following speaker effectively. Yeah, thank you very much. So may I invite the second speaker?
Dr. Vian.
Yeah,
Please
Dr.
come.
Vian Mani. So
the
Dr. Vian Mani, for the topic is bridging the gaps in promoting health equity. So Dr. Vian Mani, as Khun Thanta already really introduced, she's Deputy Director General of the Department of Planning and Cooperation, the Ministry of Health, Lao PDR. So we give the floor to you. Thank you.
for question and answer, we will have after the end of all the presentation. So please go on that. Huh? Thank you.
Yeah.
Yes. Okay. We need share screen.
Sabayadi, everyone, and online and in person here. So first of all, thank you very much for having me to have an opportunities to share the Lao experience on bridging the gap in promoting health equities in the experience. Slideshow. These are my contents based on the forum requirements. I will cover 3 contents here. So let me start with the health inequalities and its far to reaching the implication, the witness from COVID-19 and lesson learned from the Lao PDR. So first of all, I would like to start with our key health indicators, which is our priorities of the health sector. As you can see, so we have selected 11 core health indicators in this. So 6 health indicators in the group on track, tend to achieve the target. And we have 2 in the orange one is still have the challenges to achieve the target, especially for nutrition for children. And we have 3 core key indicators, which is very risky to not to achieve the target. For example, immunization coverage, delivery with skilled attendance, and the proportion of population using the basic waters. So despite we have the good progress in to achieve the National Health Assembly indicators or our priorities, 11 indicators. So, but we have the significant disparities. For example, as you can see, we have the infant mortality rate and under 5 mortality rate for people who live in rural or rural without roads is higher than people who live in urban areas. And same as people in different income group or different quintiles. So we have the high infant mortality rate and high under 5 mortality rate with people with the poorest group, and skilled attendant is less than people who have high income. So during the pandemic, COVID-19 pandemics, as you can see, the OPD visit or people who receive the essential health services has declined in central hospitals, provincial district and health centers. Compare with the data from 20 and 2021, we have declined. And the immunization also difficult to deliver. We have fixed size immunization only almost half or 54%, but we need to do like outreach activities or mobile activities. So when we talk about the how to bring equity to the health, so we talk about the social health protection in the country. As Lao PDR, the government has committed to achieve universal health coverage in 2025 by expanding the population and service coverage to achieve the financial protection for all our population. In line with this, we have also health sector reform strategies. The framework until 2025 so aim to achieve universal health coverage. And we are now revising phase 2 and 21 to 25 to expand the health sector reform to aim to reach universal health coverage and adequate benefit package and provide appropriate financial protection for the majority of population. And we need to expand to cover more than 95% of total population by 2025. And we aim to reduce out-of-pocket payments and reduce the out-of-pocket to 40% of the total health expenditure, less than 30%. To achieve this objective, the government has significant effort to enhance the financial protection and extend the social health protection in the countries. Previously, we have a challenge to expand the social health insurance to all populations. In terms of Lao context, people become the insured person and they drop out. So since 2016, so the government has introduced the rollout of the national health insurance schemes. It means managed by the National Health Insurance Bureaus under the degree of health insurance. So under this policy, so the Lao population will cover all the coverage of the scheme, including the public, private, and military and police officials, reach 60%. Right now, it's about 94% covered by health insurance in 17 provinces, except the Vientiane capital. So this rapid increase the population coverage, then the harmonization of the scheme, we enhance the health service financial protection from catastrophic health expenditure for large population, contributing to the health policy direction toward achieving universal coverage by next 3 years. So when we talk about the health financing situation in Lao PDR during COVID-19 pandemic, so as you can see, we also share common effect of the economy as like other country in the GMS country. So the GDP the GDP growth rate has dropped, and the government debt also increased a lot, and you can see in this graphic. So the government, the public and publicity guarantee debt is increased to 88% of the GDP, about 14.5 billion last year. And in the public sector, we have external debt service due to 1.5 billion per year until 2025, which is about half of the average of domestic revenue. And what the COVID-19 pandemic impact on the health sector. So the health sector, as the government budget for the health was cut 30% at the central level. Our budget will cut up to 30%, but only 10% at provincial levels since 2020. But the budget from the government is deficit for many years before the pandemic already. And this may lead to the delay of the delivery of the health service and decline in the quality of and quantity of the healthcare services. So because the impact of economy has reached the high inflation rate, so the budget to purchase medical and drug supplies has jumped and increased a lot. So therefore, the substantial drop of the use of essential health services was observed and compared in the previous year based on the data from Ministry of Health data we call District Health Information System. So we concern and anxiety over COVID-19 among the public affect the health-seeking behaviors. As you can see, previously the OPD and service was dropped during the pandemic, and leading to the reduction the uptake of essential health service during the pandemic. So, and this is the experience how we take equalities issue into account during the COVID-19 and in the COVID-19 recovery plan. We implement from national to regional plan. For example, the first one is we developed before the community outbreaks, we developed the national COVID-19 strategic pandemic and preparedness plan for health 2020 to 2025, which we consist of 10 pillars. This strategic plan applicable and cover for all other communicable disease and emerging disease in the future. For example, we have 10 pillars from the common coordination and planning. So we established the EOC centers in the Ministry of Health and in the provincial levels. And the second pillar is about the infection prevention and control during the COVID-19, about the clean water and water for hands washing. We also, the third pillar is about case management to treat the COVID-19 patient. So it's free for everyone who infected COVID to receive the treatment in hospital is for free and under the health insurance scheme. And the fourth one, in this strategy, we have strengthened the surveillance and laboratory system of the country. The fifth one, we also talk about the risk communication during the outbreak. So we have the Center for Health Education to provide the risk communication knowledge and how to prevent the COVID-19 and access the numbers of COVID-19 case every day and death case or recovery case. We also have the public health and social measures for COVID-19. In this, we also have COVID-19 deployment plan. So we also join the COVAX facilities that we can get the COVID-19 vaccine timely and effective for all our population and people who live in Lao PDR. So we receive the COVID-19 vaccine quite timely and provide and distribute to Lao people. In 2021, we cover 50%. And this year, we aim to cover more than 80% of the Lao population. And last month, we also received the COVID-19 for children, we call pediatric COVID vaccines. So we also have the essential health services. In this strategy, we also implement the telehealth in the country for mother and child health to use the mobile to consult the health personnel during their pregnancy or have any complication case in selected provinces, for example, Luang Prabang. And then we also strengthen the our 8 pillar is point of entry, strengthen the point of entry in border in the countries. And we also have the talk about the availability of drug and medical equipment and also conduct the monitoring and evaluation. And then we also implement the TMS COVID-19 response and recovery plan 21 to 23. So the regional plan, we also have the 3 pillars as the Dr. Raymond has presented this morning. So, and then a part of this, we have many supporting projects, for example, ADB Health Security, ADB Additional Fund Project. We also have a COVID-19 project from World Bank, $18 million. Also the project from Global Fund and EU or the Fed and Japan USC Fund and etc. Which we can, we have we get 2 years, 20 to 21, we get more than $161 million support to combat COVID-19. And we also have the, during COVID-19 outbreak, we have multisectoral cooperation and community participation. For example, the health sector, we cooperate with UN agencies, WHO, UNICEF, UNFPA, and other UN agencies for COVID-19 recovery plan and resilience framework, how to maintain the essential health service in the country. And to get some donor coordination and private individuals and donation. And we also have collaboration with other relevant ministry, for example, Ministry of Transportation for borders, Ministry of Culture for public, and the Ministry of the Prime Minister Office, and communities as the head of village, they participate and collaborate with the government to conduct the COVID-19 prevention and control, which we have learned and achieved to prevent the COVID-19 in the country. So, and the recommendations from the One Health, I think we should build the resilient health system to narrow down the gap of quality of health services in the region. For For example, the quality of health service in Laos is still have a gap of quality. For example, as you can see, people from Laos, they travel to receive the treatment in Thailand during COVID-19 lockdown. They cannot come. And we need to improve the service quality, and by improve health infrastructure, we use the fund from the COVID-19 project to improve our infrastructure. For example, the isolation center, the medical equipments and drugs. So we use this one to turn and our opportunities to improve the quality of health service. And as well as the laboratory capacity, we improve from the COVID-19 project and project support. We also improve the competency of human resource for health, since it's very new emerging disease. So we have learned from other countries online and UN or WHO to conduct the many training for health staff in the country. We also improve the point of entry facilities. For example, border check up the COVID-19 testing, tracing, or personnel were trained and to work at a border checkpoint. And I think the second recommendation, we should improve trade and private sector and valuation and tourism to improve business and investment environment. This now also include the government health financing strategy for the NSEDP, National Social Economic Development Plan, for until 2023. And we need the regional economic integration, e-commerce and e-health or digital health during COVID-19 pandemic. We use the our innovation information system for Ministry of Health to collect all the data related to COVID-19 to the Ministry of database and vaccination. We can report day by day. And we should improve the border area of health system strengthening by managing the change and enhance policy preparedness for recent work related to Ministry of welfare for wage labor migration in borders to mitigate the impact COVID-19 by expanding universal health coverage to migrant workers or mobile population, which they are not in cover now. And lastly, some recommendation for regional cooperation. I think we should strengthening the regional cooperation and collaboration on the communicable disease control, especially when the people travel, if they carry the infected, the disease also travel with them. We also need the regional disease surveillance and outbreak response system. And then we should have the knowledge exchange on health planning and planning for regional cooperation and financing and monitoring, including the health management information system by using the digital health or health innovation. And lastly, we need to improve the multisectoral collaboration conducting One Health approach. Apart from COVID-19 lesson, we have been successful with cooperate with other 11 ministries to control the COVID in the countries. But we have different roles. For example, health is take care of the people health, and agriculture they take care of animal health. But we need to collaborate and meet each other to exchange the progress of implementation and report to the national level. And in December, Lao PDR will host the GMS ministerial meeting with the team to accelerate the economic recovery and expand the 30 years of the GMS achievement toward the inclusive sustainable developments. So this very an opportunity, good opportunity for us to share the experience and agree some regional framework together. So that's all for my presentation. Thank you very much. Any comments are welcome. Thank you.
Thank you very much, it's very clear why we're waiting for the third speaker because he's online. So you see that the Lao PDR have done a lot of things to achieve user health coverage in 2023, and they have many phases. And also with the high pandemic of COVID, the budget had cuts, but the government have done a lot of really improve many sectors to improve the coverage and quality of service in order to reduce inequity. So I think we will talk more by the end of the session. Okay, please. So the third speaker is like Dr. Sarmiento on the perspective toward the accessibility and affordable digital health solution in Southeast Asia. Please.
So we will have the pre-record video, right? So, and then Dr. Remo is also already online as well. So hello, Dr. Remo.
Forum 2022. I'm Dr. Raymond Francis Sarmiento. Today, I will be talking about prospects towards accessible and affordable digital health solutions in Southeast Asia.
Speak.
Just a general disclaimer that all statements issued are mine alone, and my presentation does Good morning, everyone, and thank you to the organizers of Good morning.
Please wait for a second. Just for the video, audio a little bit. We need to a little bit raise the audio voice, please. So Dr. Remo is already online. So if he can, Dr. Remo, you are please feel free to also, especially question and answer session. We will need your presence with us. Thank you for sending us the pre-record video in advance.
Good morning, everyone, and thank you to the Good morning, everyone, and thank you to the organizers.
I think that the system is there. Right.
Of the Mekong Forum 2022. I'm Dr. Raymond Francis Sarmiento. Today, I will be talking about prospects towards accessible and affordable digital health solutions in Southeast Asia. Just a general disclaimer that all statements issued are mine alone, and my presentation does not necessarily reflect the position of the University of the Philippines or the Philippine government. I also
I think that in the morning we play the video and it played very well. Now I think that it has some problem with the sound system. So if like to save the time, I think that we will move to our last presentation. If Dr. Wipa, if you don't mind, then let our technician fix a little bit the audio problem first. Then we will come back to the digital One Health solution later. Right now we'll talk to the One Health. No, thank you so much, Dr. Wipa, please. Yeah, thank you. you please stop sharing? Stop sharing. We'll do that. Huh?
So hello everyone. So thank you for the organizer, Mekong Institute, for inviting us to present our work in terms of One Health capacity building and research. So my name is Vipat Kurichitam. I go by Pat. I'm in charge of the Southeast Asia One Health University Network Secretariat Office based in Chiang Mai, Thailand. So with that, I try to also look at the time so I can keep us on track. So I think we all know the impact of the COVID-19 made us and that's resulted in the shift in so many activities, including a Mekong Forum for the past 3 years. So we don't want that to happen again. And if that's the case, how are we going to do it, right? So this one is not new. You already seen Dr. Wongsa show this slide. So for the one who not too familiar with One Health, so there's an expert, high-level expert panel of the World Health Organization. So this is a brief definition that I like to read it. So One Health is an integrated and systematic approach to health, grounded on the understanding that human health is closely linked to the healthiest of food, animals, and the environment, and the healthy balance of their impact on the ecosystems they share everywhere in the world. So I circle in red on the capacity building part on the One Health. I think that's what the missions that what all Sihun, our regional network has been doing for the past decade. So let me reiterate why that capacity building is important. So as Nilsa Mandela say, education is something very powerful that we can use to change the world. So the lessons learned from us, this is even before the COVID-19 time in 2018 that I participated in the World Bank Health Security Financings in Vietnam, because we know that the pandemic or the outbreaks happen so frequently that in the past. We heard of the 1918 pandemic flu. Fast forward that the frequency is more and more. So the world is just started on preparing how we're going to finance, how we're going to prepare actually before the COVID-19 when it hit us, and then we know that we are not ready for it. So it's emphasized that the workforce development is fundamental for ensuring a sustainable and effective health security system. So therefore, we have to invest in the human resources. So is this the right one now? So that the ensure that we have to invest well in the human resources for health. So we know for sure that it is very worthwhile investment, but with all the competing priorities with the countries is also being override that, if something there were not outbreak, there will be no such big investment in terms of preparedness, because it's the funding limited resources within the country always shift toward other priorities. We hope that's not going to be the case since we're on the verge of the end of the COVID-19 shifting from the pandemic to the endemic. So hopefully that's not the case. We learned the lessons. We should maintain the momentum and try to advocate it, how we're going to build the case for One Health and the investment, especially in the human resources for health. So with that in mind, introduction to our organization a little bit, Southeast Asia One Health University Network, or COHUN for short. We are initiative of USAID, about a decade old, established in late 2011. We connect and bring together over 95 universities in 8 Southeast Asian countries. So all the ASEAN member states, except for Brunei and Singapore, which are the high income country that we hope to connect them to be our resource persons. So our mission is to develop a resilient and competent One Health workforce to effectively the 3 pillars that Dr. Wongsa mentioned before: prevent, detect, and respond to infectious disease threats by leveraging what university actually doing well, which is education, research, and training, and including the community services that provided by our member universities. So you can see that these 3 pillars, prevent, detect, and respond, the human resources are actually the cross-cutting theme. So we hope to have the competent One Health professional. So what we are trying to advocate for as a network of academy is the role of university to do 3 things that the university are quite doing well. Which the first one is to build the capacities of the professional. So with that, our model is not to build only the pre-service, the students studying at the university and the undergraduate level and the master degree or the graduate level, but also the in-service, the existing health professional, try to address that gap, whatever that they have. So when we try, this is the principle of One Health, we try to bridge the gap between the 2, at least 2 major disciplines, which is the human health and the animal health or veterinary side. So when we champion all the training, we try to bring the 2 sectors come together in the same room and try to share different perspective, because no one knows it all, but together with the effort, we can make our world better and safer. So not only that, that we champion all the technical skills that we build at the school, at the university, yes, they are doing very well on the technical side, publication on the technical skills. But we believe that the world is a bit at chaos these days because we are working in silos. So not only the technical skill that we try to build, we try to break down those silos by equipping the future health professional or the in-service, the existing health professional with what we call the competencies or the soft skill side, how they're going to do our collaboration together better, communication, critical thinking, creativity in terms of solving increasing of the world complex challenges. So with that, we have to be able to take off different hats that we don't know it all. We have to learn from one another with a different perspective to solve the challenges like the COVID-19 that impacted not only among the health sectors, Ministry of Health, but touching across the broad, including tourism, economics, port entry, and all the others. So the second part that we advocate for is to conduct the research that try to address the gap of the policymaker that it needs for the decision making. So what we need to do, I was a part of the faculty members before I taught at university prior time once I graduated. So a lot of university researcher or professor, they will focus on what they are passionate about, doing a research and doing publications. So that's a fact. Publication, we're proud of what we do. I was in that group as well. So we don't think too much about what's afterward after we publish, how we're going to make the impact in the field, how we're going to link that to the ministries to make the wider, right, to make more implementation, not something that being in a journal article, which is very difficult to read for the general public and just sitting there in a journal archive for the student, next generation to come and look at that. So we hope to bridge those gaps, trying to say that whatever that the ministry needs the answer in the evidence base, inform us, try to bridge those so the university can solve the right issues that they need on that. So the lastly is to support the public health search when the people are overstretched. I mean, especially the health professional during the pandemic time. We believe that universities can help deploying the the student who being trained as a helper, maybe in the outbreak investigation, university laboratory, can help for diagnostic and testing, can help with all the innovations. So with that in mind, I highlighted some of the lessons learned from the COVID-19 pandemic in three points that we think that we can prevent some of the a big impact of the pandemic in the future. First, we saying that everyone needs to know and be aware of their actions, of the interconnectedness between human health, animal health, and environment. So we have to raise the awareness of One Health, that everything that we do, whatever that action that you do actually matters. If you destroy the environment, in the end, we're going to have seeing increases of the diseases. So with that in mind, we do that level. So not enough, we have to distinguish between individual rights and social responsibility. So we can see that with the COVID-19, right, that we do that say that, okay, this is my right to not to wear mask in some country. And the social responsible is mean that even though you're uncomfortable, but it's better to public. So how we instill that, it's really difficult. That's why we try to have that since the school, the great kids, the younger that we can build the knowledge, the perspective, the better it is for that. So we partner with Chevron, private sectors, try to strengthen the education in school, in the border school, with the collaboration with the Simeo TropMed network and STEM Ed to implement that as a model in Thailand. We also extend that the university group, right? So we have school right now. Sihun is doing university, that's our strength. So next up is to do the community. So that's how we partner with, you see the last icon of the TDRC, that tropical disease research centers from Khon universities implementing the model, how to implement One Health in communities and how to sustain that effort for the longer term. The second up is that we look in terms of sustainability in the longer term, not only for the shorter term. So in order to be having that, so we try to institutionalize a One Health education offering at the universities. So it can be offered for the graduates for years to come, not only just batches, because we believe that the people who practice, faculty members at the university, they do not move around that much compared to the ministries where the resources will be cheap. Once you train someone, it will be promoted, it will be transferred from one unit to the next unit. So university is a good place to institutionalize One Health and try to build the capacity building of others for years to come. So lastly, we know that we cannot do everything by ourselves. So we need a partnership. So we must work together to address this world challenging problem. So academia that we present is just only part of the equation. It's only part of that. So with that in mind, Sihun is partnered with at the global level, regional level, as well as the country level. At the global level, we are a member of the Global Health Security Agenda. If you're not aware that GHSA is an effort by the nations of the international organization, civil society, try to accelerate the progress toward a world safe and secure from infectious disease threat to promote global health security agenda as international priorities. So right now, today, there's 70 member countries around the world joining this effort voluntarily, as well as UN agencies of the FAO, WHO, World Health, WOA, World Organization for Animal Health, and we are part of that. Interestingly, the private sector is also a member of the GHSA. So why? We believe that, that the private sector, they see that the impact that they have, right? So with the COVID-19, it's with the tremendous trillions of economic loss. So with that, I think it's of their interest to work together around the world, how we're going to prevent this from happening again. So we are a member of that at the Sihun. We contribute to different action packages that they saw. So we listed 3 that we are committed to contribute to, which is workforce development, increasing the national laboratory systems, and lastly on the zoonosis, zoonotic disease. How we're going to contribute that. So we're part of the members of that. At the regional level, we play at the different platform. We partner with the ASEAN Health Cluster 2, which is focusing on the responding to all hazard and emerging threats. And they are for the capacity building. This one is the ASEAN +3 field opportunity training network of that. So Sihun is also a steering committee member of that in this group, and try to partners, not only try to bridge the academic with the practice the in-service professional. So with that, we also trying to do that the pillar of the ASEAN in terms of health. For the ASEAN pillar in education, we apply to be a CMEO affiliated members. So we're going to be not yet there, but we are partners. One of the partners, we're going to be presenting at the CMEO High Official that's coming in late November, and hope to be affiliate members, try to promote One Health education at all levels. So with that in closing, we have so many other partners that we work with. This work, we cannot do it alone. It's across sectors, development partners, private sectors, international organization, international NGO, so on and so forth, together in this arena. And we hope to reach out to all of you here listening online in this earth to partner with us in terms of strengthening One Health education and research. So this picture portrays that, to weather the storm or the challenges that we have, we cannot do it alone. We need more people, not one sector alone, not one discipline alone. So we have to work together. So this is one of our Indonesia One Health University network that they use a lot. They say less me, more we. So with that in mind, this is my closing slide, is that to call for us to collaborate among the ministries, university, academia, the private sectors, and other development partners, all of you, in developing One Health workforce, generating evidence-based for information for policymaker, and maintaining public health search capacities. So we must unite and work together to build resilience, especially in health securities in the greater Mekong sub-regions. So with that, thank you very much, and look forward to the discussion toward the end.
Thank you very much. So anyway, so the third one, you are ready, right? Yeah. So I think we will kind of keep the time for the summary and also question for you after the Dr. Lemon's present. Thank you very much.
Of the Mekong Forum 2022. I'm Dr. Raymond Francis Sarmiento. Today, I will be talking about prospects towards accessible and affordable digital health solutions in Southeast Asia. Just a general disclaimer that all statements should are mine alone, and my presentation does not necessarily reflect the position of the University of the Philippines or the Philippine government. I also declare no conflicts of interest with any proprietary entities I may mention, nor do I have any financial relationships with any of the manufacturers of any commercial products or services that I may mention during my presentation. These are my competing interests as it relates to this presentation. So today we start off with the innovation drivers in healthcare. I'd like to direct your attention to the middle of the screen, wherein digitalization of health and healthcare really has been spurring on all of the innovations and the rapid evolution of science and the field of medicine specifically, and how we'll be able to provide improved access to healthcare services, low costs, and something that's much more affordable, especially for those that are in low resource settings. But of course, with all of those that are made available and all of those who are availing of these services, Obviously, there are unsustainable rise of costs that eventually will be spurred on, and therefore it behooves all of the stakeholders to look into ways on how to digitalize health and healthcare services. On the left-hand part of the screen, you'll see that the global population for those that are over 60 will be at least 1/5. So that's something that we really need to focus on, especially in terms of what can be provided to them on digital health solutions. 2040, the world will be spending around 25 trillion US dollars on a yearly basis just on healthcare alone. And on the right hand side, the multitude of health applications that will be made available, especially since we're looking into the age of big data and analytics, spurred on with social media and all of the different platforms available to us. But at the heart of it, and this is something that I oftentimes use as a graphic when I give presentations, digital health is really more than just the technology. So with all of the contraptions here and all of the equipment, at the heart of it is really the patient, and the patient is the one that we really have to provide better healthcare, lead to improve patient outcomes, and how we will be able to provide that same level of care to all of our patients and to the public health. Policy questions will be our starting point, and we have to be able to anchor all of our activities and initiatives with the existing policies, and if there are no existing policies, what anchoring policies should be in place for us to be able to provide a way to make sure that all of these digital health enabled services are successful. Number one, we have to identify the barriers for preventing the full implementation of digital health services. By identifying all of these, we'll be able to look into what possible solutions could help address these barriers so that the risk can be mitigated with regards to digital health enabled services. Number two, what are the policy levers or interventions needed to lay down digital services for health service delivery, and how will these policy levers remove the barriers for full implementation of digital health enabled services? The fourth one deals more on the technical aspect in terms of the requirements for implementing digital health services in service delivery. And obviously, with the age of interconnectedness, we are so much more connected right now than in previous centuries. How can we leverage social media for the deployment of these digital health services, be able to help in improving healthcare service delivery to everyone, especially those who are in geographically isolated and remote areas? And how can these policy interventions and technical requirements come together for us to maximize the benefits and advantages to be gained from these innovative technologies like big data, artificial intelligence, and the Web 4.0. In the Philippines, we started with electronic medical records, electronic health records. On the screen are the top, the first 6 and the top 6 electronic medical record providers in the Philippines. We wanted to be able to showcase that there is a way to more efficiently and cost effectively process all of the digital information being collected at the patient level, and how we could leverage all of that so that it could be an influencing factor and a critical element for us to arrive at crucial policies that will be needed for implementation. We have been at this for the better part of 2 decades, and we are still working towards a much more improved ecosystem for electronic medical records and electronic health records. Interoperability, we really started on this in the middle, probably 2014, 2015, and then moving forward a few years thereafter on making sure that systems, or let's say devices such as this telemedicine device, RxBox, be able to connect with other electronic medical record systems and other digital health solutions through innovative ways of information exchange. And in this scenario, it will be HL7 Fire that we have used at the outset, and we continue to use that with all of our other implementations, which I will be later mentioning in my presentation. Next, the Philippines has also figured prominently in terms of blockchain-based applications. HealthBlocks is an award-winning, I think they placed first or second during the 2018 Dubai Invitational. It's a blockchain-based electronic medical record system, making sure that the information is more readily accessible. On the left-hand side are examples of real-world blockchain use cases. And obviously, there are examples in the healthcare sphere that has been explored. And we are looking at the regional level, Southeast Asian level, how we'd be able to provide that sort of technical assistance in implementing blockchain-based, let's say, supply chain management systems, logistic information management systems for those that are in the region. In the Philippines, we also have our vaccine information management system for COVID-19. I list down here the processes and the systems that we have, as well as the support activities for these systems to be made possible and to be enabled to be successful. Very important to note that we are bringing several processes, several systems together into one, and all of the stakeholders who are managing all of these disparate systems. So how all of these tie together really boils down to having a centralized data warehouse, and all of the submissions really, and especially how they all connect to a centralized data warehouse, and having that centralized data warehouse connect to our projections database and modeling systems really have to deal with the use of HL7 Fire. But for this one, what we are focusing on are the processes for, as it pertains to master listing, for supply chain management, for the actual vaccine administration, and the uploading of the line list records to a centralized data warehouse. And obviously, how we are able to analyze all of the data coming in, both at the local level and at the national level, for us to be able to be more efficient in the distribution of the vaccine, be able to identify points of hesitancy geographically in the country, the distribution, how we'd be able to provide better avenues for distribution, especially if there are areas that more, let's say, demand for a vaccine compared to other locations. And then obviously we're talking about the digital vaccination certificate for us to be able to be more mobile in terms of our travel, and aiding the mobility not just within the country but inter-country as well. So I've already mentioned digital vaccination certificate, which is compliant with the WHO digital documentation of COVID-19 certificates, and also compliant with the EU DDC, also on something that we have really earnestly worked for the better part of a year to make sure that we are compliant with all of these recommended guidelines. And as mentioned at the top of my talk, all of our efforts really are anchored on an existing policy, and this policy, at least for the Philippines, is the Universal Healthcare Law. I'll just read an excerpt of RA 11223, which states on Section 36, Health Information System, all health service providers and insurers shall each maintain a health information system consisting of enterprise resource planning, human resource information, electronic health records, and an electronic prescription log consistent with DOH standards, which shall be electronically uploaded on a regular basis through interoperable systems. But really the challenge of the law in terms of the digital health sector is achieving integrated local health systems. How can we make sure that information, patient level information collected at the primary care level and has to feed to secondary care facilities, especially for patients that need a higher level of care, additional services, and then moving into tertiary care facilities. Maybe they need special surgeries or special attention, or it's a trauma case, and how all of these could be helped through a referral to an Apex hospital if all of these primary, secondary, and tertiary care facilities are not able to provide those services and make those services available. Making sure that this entire ecosystem of service delivery networks are integrated to be able to help not just those that are able to afford or those that have these digital health technologies at their disposal, but everyone, because in universal healthcare, no one is left behind. Our goal, and especially since we're talking about digital health in the Philippines, really the holy grail for us is to be able to achieve Philippine Health Information Exchange, which is based on the Open HIE, Open Health Information Exchange framework, wherein we have the point of care applications here. I should have put in horizontal bidirectional arrows at the end of it to be able to indicate that hospital management information system data gets shared also with electronic medical record systems at the clinics or health centers, and the laboratory information systems and the pharmacy information systems. But the gist of it is to be able to have all of that data from the patients be integrated using a point of service application or health integration module. And at the back end of it, be able to connect all of that through National Health Facility Registry, a National Provider Registry, a Client Registry, Patient Registry, shared health records, the National Health Data Reporting that's needed by our Ministry of Health or Department of Health, our National Health Insurance Program as well, and how all of these use the same standards and terminologies so that they are able to semantically understand one another. Digital health enabled networks are very, very critical for us to be able to provide citizen-oriented service that is transparent and interconnected, having personal health records at the disposal of the citizen or the patient. At the heart of it is healthcare communications and collaboration, and being able to say that our shared health record really spurs on not just the innovative part of the discussion, but more so patient safety, improve access to those services, and improve service delivery. Something that we really hope could be achieved within the next 5 to 10 years. In the region, and these are what we have learned through our technical assistance that's being provided to countries such as Thailand, Indonesia, Vietnam, several other member countries, Cambodia in the greater sub-Mekong region, and those that are obviously in the Southeast Asian region, is to recognize and engage all the stakeholders, from the citizens and consumers, media influencers, policymakers and regulators, health executives, clinicians and clinical leadership organizations, digital health technology suppliers, and the academe. And the keys to successful implementation really would have a whole of system approach, and something that we really learned when we were implementing all of these systems during the height of the pandemic, not investing in obsolete solutions and being able to learn and reuse success from others, whether it's local or whether it's from outside of the country. That's something that could be applied for that particular country's use case that will be helpful as well. And being able to be cognizant of the appropriateness of the maturity level. Are you ready in terms of your infrastructure? Is your healthcare workforce competent enough? Are they skilled enough? Or is there a need to build their capacity? Really, at the heart of it, we have to understand that starting small and showing benefits through evaluation is very, very critical, and has to be built into a general health program, and to be able to iterate as we try to scale and scale up and increase our scope for a more national approach and regional approach, such as Southeast Asian region. Next, and finally, my take-home message, key investments in human resource development, infrastructure, and R&D need to be made and sustained in order to improve productivity, increase overall efficiency, and disseminate quality knowledge products. A whole of system approach is necessary for us to accelerate our recovery from the effects of the pandemic, and ultimately it will be up to us to define whether the embracing of interoperability and health data sharing will work for us, with us, and hopefully not against us, towards the goal of having a more resilient and healthier Southeast Asia. If you have any questions, please feel free to contact me at rrsarmiento@up.edu.ph. Thank you so much for listening, and I look forward to your questions.
Yes. Thank you.
So Dr. Raymond, please. Hello, Dr. Raymond. Are you with us? Yeah, I already unmute. I asked to unmute already. Yeah. Just go ahead. I think that maybe like we move to another question. Dr. Raymond, we will hold on to that. I'm sorry for technical one. I mean like technical error. I think that we still that small error. So yes, please.
So right now, our students, like doctoral students, introduce the personal data for the research of physics. I think it takes a few months to move the software. It's very important. Can you do something like this for high of before gathering the data that they will allow us to use the data by not really show the or put not straight back to the individual person. So please cover it. Yeah, so I think it's complicated. I think in some countries are not really complicated because I still use data in China. Yeah, but I not use the data in Thailand. So right now, most of our study became the GIS, so the spatial analysis, because we use the average of provinces and really show because we do not use the each individual one. So this sort of thing that really affects. So and I will look for the answer for you, and if anything really kind of progress in the positive way, we will kind of respond to you. And then yeah, so I think we can we move forward to other question, please? Yeah.
afternoon. My name is Halim. I work in evaluation and learning specialist. I want to thank all of the speakers for so valuable information we get, and it's really huge information. I have not been able to digest all, but still I want to ask one more question.
Yeah.
That is, I mean, the topic is strengthening health and society resilience. So I was looking like probably you would address the mental health issues. I mean, that was, I didn't hear from you. So when we were, I mean, so far I understand this come from the COVID resilience mostly. So when we experienced this COVID issue, we were locked down in the house and we could not go out. We lost our jobs and we were frustrated, depressed. And then I saw the study that in USA, in Europe, the domestic violence increased significantly. So when you are implementing this One Health program and increasing the resilience, so is there any assessment of the mental health status for ASEAN countries and how you are integrating these issues? I mean, in addition to the regular, I assume that the status of the current mental health is lower than previous. So probably you can highlight what is the status and how you are incorporating.
Thank you. Do you want to answer or let me answer this question? So because it's human health. So actually, like you are correct. This is very important question because like mental health is very important because they are isolated and many of them got depressed. And the other thing is stigmatization. Because like at the beginning, when anyone got infected, they're being stigmatized that you do not really protect yourself, you not conform to the regulation, blah, blah, blah. That's one thing. So now we assess it, right? I think you put the idea that among our greater Mekong sub-region public health network, we use the topic as like multisectoral collaboration. And now what we do is, we study long COVID. And we also, not only that, the thing that you mentioned, we also put post-traumatic stress. But normally we use post-traumatic stress in terms of really like violence, war or whatsoever. But this one also considered as very traumatic, and some of them may be critical because they use oxygen or ventilators and stigmatize and everything. So right now, yesterday, I still kind of edit the questionnaire for the doctoral student that after she passed the ethical approval, she could collect the data in the northeast of Thailand, and we will use this and share among the greater Mekong sub-region public health network. This is very important, sorry, because we did not really mention about the other thing is about society, social. There are, it's been like crisis, like with the crisis, it brought up so many things, collaboration. You could see the multisectoral collaboration is vertically and horizontally. It's never happened before. It happened in many sectors and many countries. That is the good thing also. So thank you very much for do I answer your question?
Yeah.
Yeah.
I think that there will be many more questions,
Yeah,
and you can
okay.
also connect with the speakers later. I think
Yeah.
that you can go on and go on because there are a lot of aspects in the health, right?
Yeah.
So, but I think that because of the time limitation and other thing, I just like come with the 2 questions.
Yeah.
Then after that, we will close the session. Of course, one session came from our online participant. So one of the, let me ask. So one is about the what could be the current program which are implementing to implement better healthcare service digitally, talking about the daily health program to tackle the current and future challenges. So I think that regarding this question is pretty covered by the Dr. Raymond as well. But however, in terms of the maybe Laos and Thailand, you can give just a brief question in terms of the daily health service or digital health service. Yeah. What are the prominent ones?
Actually, like it's not only technology,
Yeah.
right? It include many things, right? In terms of telehealth
Yeah.
or whatsoever. So this sort of thing, you need kind of like the system and also the understanding of the each sectors, and especially Dr. Ipa said that like workforce capacity building is very important how this month, and then like Dr. remarked about kind of what the quality improvement. The problem right now is why we need this. Because if you could not reach them, how could we make sure that those who live there, that like the service at the central, that is the best quality, could access? So we have to do like another way around. So that sort of thing that is important, because if the quality is equally distributed, we will not have any problem of inequity. Even you have user coverage, but the kind of distribution or coverage of service is not there, and also the quality is not guaranteed. It's going to be the problem. That's why, and telehealth is really tricky in somehow, right? Because it's not only the technologies, but the contents and concept, how you really efficiently use it, right? Whether it's kind of using to improve health, and somehow how could you manage the kind of how you call commercialize, because there are two sectors, right? The public sector and private sector. There are a lot of, if you see that there are a lot of nursing home or health institution of the private that provide this sort of thing. Because normally what the perception we have is we use this one for the critical, right? The critical patient, right? In the public sector. But in the private sector, the telehealth or the application like it, they use for the normal patient or mild or moderate patient who live at home or in somewhere that could access. This is different dimension and different what the objective or goal, which is this is one need a lot of kind of intervention and policy in order to manage this properly. Otherwise, we will have like something that spill over in a negative way.
Right. It can have the counter effect as well. So we have to be, but still we are still moving forward, right?
Yeah.
To go that. Dr. Vian want to add and one thing. So
Dr. Lemon is already here.
Sorry, I just briefly share the experience from Lao PDR for the questions from mental health. So during COVID-19 pandemic, Ministry of Health and mental health expert from WHO, we have developed the guidelines on the mental health and psychological support for guidelines for the people. For example, not only the people who are affected infected the COVID-19, but also the health workers. They have to work for 1 week and quarantine for 2 weeks. So they also work with very stressed. So we also develop the guideline how to provide the consultation with health providers and the pay for social psycho support. Yeah, we would like to share this one. Thank you.
Thank you. Very good.
thank you, Dr. Vian.
Yeah, very
It's
good
very
response.
important,
Yeah, very-
mental health thing. So I think the last one where we go for the Dr. Remo.
Yeah,
It's
he's
like-
here already.
So Dr. Remo, I think that you can handle the last question. I mean, the question in the chat box is talking about especially you talk about the affordable solution and, accessible one. But when it comes to how about the vulnerable group, like especially it's from the IOM as well, right? IOM, the participants from IOM, us, like migrant workers, like when they need to register through the ID numbers and so they cannot access the platform. So what should be our measure and the thing we should take in consideration? Those language area, considering all the vulnerable groups.
Thank you for the question. There are multiple groups and initiatives already that are looking into providing that sort of solution with regards to having that national ID, or at least a sort of identification, given that one of the vulnerable groups that we're talking about are the migrants. Yesterday during the, I think it was Global Digital Health webinar, we were discussing with colleagues from Tasmania as well as from Africa on how all of these really have been deployed at the very least for in a pilot situation for them to be able to provide those types of services to the citizens that they are servicing. Another thing is that at least in the Philippines, since we are comprised of more than 7,000 islands, which is not dissimilar to how it is in Indonesia and other archipelagos, we have been working with up and coming companies such as Starlink to be able to provide that sort of infrastructural availability on internet activity, especially in areas that have no cell towers, that have poor signals. Another thing is to be able to work with social media companies such as Meta to be able to provide that sort of service to those at low to no cost, to those who are in the far-flung areas, those that have unstable power activity as well as internet connectivity. Those are the ones that we do not be marginalized. Our goal is to not increase the digital divide just so because we have all of these technologies and they don't have that. We want to be able to bring them into the fold and provide that sort of service that anyone who is living in an urban area could also be availed of if you are living in a remote or rural area. Thank you.
Thank you, Dr. Remo. I hope that so they are still because like especially language barrier and other things like we also encounter in Thailand for the migrant workers, right? This is something we need to also work together with the collaboration with the development partners, where IOM play a big role, I am sure, and then like private sector to make it like adaptable. Look at, I mean, like do we also like the make the understandable, affordable, and also like they understand. I mean, like it's the most important thing. We also need to reach out to them, no? So this is what we also like. There are a lot of program initiated are already in place, some, but we still need to reach out more and scale up the current initiative, upscale one. So of course, scale up thing. So I think it will come.
So can we ask Dr. Vipat to say something to add to many questions? But because this is like the One Health is really cover other things outside human, not only human. Yeah, please.
So I think the questions centers a lot the people interest in the technology part that there's no doubt about that. So like on that part, I think the technology these days are there available to be implemented. I think the most challenging one is how the people in different field will come together, because people like, you know, this is my data, this is my systems, how we're going to connect to one another, and building those kind of data governance. So in building such systems, we need to really connect the people together, like multi-stakeholders. From what the practice and part of the informatics that I've been practicing a little bit, not too much, but I think the barriers is not in the technology. Technology are theirs. The barriers is in the collaboration, how we're going to get the people to collaborate with one another and shareable data, so that we can merge and combine those different data sets, not living in silo. This is the data set listing in the hospitals, the private and public, and also the system of the surveillance into the veterinary side, how we're going to emerge and combine those systems together to make it more comprehensive. So I think that the questions coming back to the collaboration, coordination, communication among multiple stakeholders, and how we're going to own and govern those data and those systems. Thank you.
Yeah, thank you very much. So because we have the time is late, we have no more time. So I would like to thank all the speakers, Dr. Viengmani, Dr. Lemon Cemento, Dr. Vipat Kurujitam, for your valuable time and very complete information, and also your experience to share. And I think our pain point is that we cover the pain point, and the most important pain point is like inequity in resources. Like many people could not access to many things, and how could we improve it? So the recovery in terms of economic development is very important. Thank you very much. And thanking all of you.
Thank you. Thank you so much. So for the documents and presentation, we will send you through email. I mean, like we will send you the scan code where you can access all the related material of the day. Having said that, I would like to thank our online participants as well as Dr. Remo. So thank you so much for your sharing your insight with us today. So for online bye-bye. I hope that you can enjoy your lunch. For our on-site, we are a little bit running behind the lane, but we need to run to our lunch room. So thank you very much. No? Bye-bye. Bye for this session. But in the afternoon, we will have the creative economy. So who have the interest in creative economy, please come back to this room.
Okay.
Thank you. Bye-bye.
Bye-bye.
Oh, stop ไว้ก่อน